Don't these junkie scumbags just stop and do something useful with their lives? Let natural selection do its thing. We're talking about the cost of Narcan. It should go up more. No one should get this stuff. How about stop using drugs, assholes? FM. Ban Narcan and let natural selection take its course. These are comments that are made by some supposed EMS peers and professionals. What's the issue here? Is it a lack of compassion, or is it a problem of insufficient perspective? Well, to talk about a unique perspective, we have a special guest coming on with us. Joining us today is Brad Jones. And Brad is a not only a paramedic, but a paramedic with some intricate and really specialty knowledge in the field of opioid addiction. Brad, can you tell us a little bit about yourself and how you came to acquire this knowledge?
Yeah, so I'm 35 years old. I've been in EMS for 14 years, been a paramedic for 9. I'm in recovery myself. I've been in and out of addiction for the past 8 years. So I've seen both sides of the fence. I've been to treatment several times, and I've since gotten sober, and I now work back on the ambulance for a hospital-based service in Atlanta.
So I think a lot of paramedics might not appreciate or realize that a lot of their colleagues could potentially have, drug addiction or alcohol addiction problems, and some of the junkies that they encounter are actually their respected peers and friends and colleagues that they work with.
Right. Yeah, I mean, there's no secret that there's a lot of mental health issues and drug and alcohol issues in healthcare. But there's that whole stigma behind it where, like you said a minute ago, there's that stigma of being a junkie, or people being a loser, or, just not having their stuff together, or just wanting to continue that way of life in addiction, when, to be honest with you, that's the last thing we want to do, is continue that way of life, especially when we're in healthcare, helping other people.
Brad, can you tell us a little bit about how you got your start in opioids?
Yeah, so I was a flight paramedic. I was flying for one of the bigger services in the United States, and that was like the pinnacle of my career at the point. And I lost that job, and I just got incredibly depressed. And instead of going home and drinking alcohol or drinking away my sorrows, I had a big prescription of Percocet at home. I have a history of migraines, and literally 2 years worth of prescriptions. I never touched them, and I just went home and I started self-medicating, and not in the intent of becoming a drug addict or to get high. I was just trying to numb what was going on at the time. And before I knew it, those scripts ran out within 3 or 4 weeks, and I didn't even think anything of it, to be honest with you. And then I woke up in the middle of the night, had incredible anxiety. I had cold sweats, was vomiting, and I had no idea what was going on. And then I just put 2 and 2 together that I was going through withdrawals. And it was at that point that I knew I wasn't willing to admit that I had a problem because it was so early on. But I knew that I had an opioid dependence at that time. And that's when I started manipulating family and friends, and would make up excuses of why I needed pain meds just to not feel that way of what we call being dope sick or withdrawals.
So how much of it was really about getting high, and how much of it was just to not feel sick anymore?
Once you get to that point of being in withdrawals, it's primarily just to get well. After a while, I'm not going to say that I never didn't take pills, or my addiction eventually led to heroin. But I'm not going to say that I never wanted to get high. But the day to day, just to get by, that's primarily what it was for. Just to take an opiate just to be well through the day. I mean, that's really what it all came down to.
So what is withdrawal like?
So a lot of people like to compare withdrawals to the flu, which is somewhat accurate, but withdrawals, the worst part about withdrawals for me is the anxiety. And it's not like having an anxiety attack where you can talk yourself down from it. Your skin is crawling. You can, obviously, opiates, numb your entire body. And when you come off of it, it's the complete opposite. You can feel every nerve in your body. Your skin's crawling. You're hot. You're cold. You're throwing up. A lot of GI issues going on. And this goes on for days, if not weeks, depending on which type of opiate. You have your long-acting opiates like Suboxone and Methadone. Those withdrawals can go on for 3 or 4 weeks at a time.
I imagine there's also a psychological dependence on it, where your next thought is just about getting to that next dose.
Yeah, exactly. And that's where a lot of the sketchy stuff comes into play, where you'll do anything. So, the whole choice versus disease debate, that's when I lost the choice and the whole thing, and the where the disease thing comes into play. I would literally do anything to not feel that way. And I mean, I won't go into detail, but I'll just say that I did some pretty sketchy stuff to not feel that way. And just it's not even, like I said, it's not about getting high. It's just about to get right again and to get your mind clear enough to where you can function again. I mean, I couldn't even get out of bed without doing anything. I could barely focus. Your mind is very cloudy. You're very dizzy. Your thoughts are racing. You can hardly even put a sentence together when you're in extreme withdrawals.
Sounds rather unpleasant.
Yeah, it's not the best thing ever.
Is there some way that you can get through those symptoms, like going through some sort of detox program?
Yeah, I mean, if you have the resources to go to detox, you can. But as we talked about earlier, you actually have to meet certain requirements to get into detox. Opiates is not a deadly withdrawal. Even though it feels like you're dying, it's not. Alcohol and benzos are the two withdrawals, are the two deadly detoxes. So there would be several times when I would try to get help. And in the beginning, I was just taking the pills. And I wasn't accepted into detoxes. A lot of people don't know that. I got turned down my first 2 or 3 times trying to go to treatment. So I just had to go back out and do what I had to do. And it wasn't until I did get on the benzos, and I moved to heroin and started my IV drug use, that detoxes actually started to accept me. And then they can take you down. Most detoxes will use Subutex or Suboxone for the opiates, and the one that I went to used Transine to get you off the benzos, so they can safely and medically detox you.
Is it where they do a little bit at a time to try and reduce how much is in your system over a period of a couple of days or weeks?
Yeah, most detoxes are about 5 to 7 days, just depending on how bad your tolerance was, depending on, there's, like I said, there's always an underlying mental health issue going on. So if you need to be on mental health meds too, they need to stabilize you. But it's typically a 5 to 7 day process.
So you've experienced the pains of withdrawal. Have you ever had any experience with being on the receiving end for like naloxone?
Yeah. So I've overdosed twice. Well, probably more than twice, but to the point where I've needed naloxone. The first time I ended up in the ICU for a couple of days. I overdosed on heroin and Xanax, and it was after a relapse. And I was actually at my dad's house. He's the one that found me. I mean, I'm sure you've ran that scene before. He found me in the bathroom and blue, barely breathing. He actually thought I was dead. Clearly, I don't remember any of this. And the next thing I knew, I woke up in the ER, and I had no idea what was going on. I had the worst headache of my life. I was throwing up. I had that anxiety we were just talking about. I have no idea what dose they gave me, how much they gave me. But talking to them afterwards, I do know that they had to Narcan me several times. And like I said, I spent the next 2 days in the ICU. And that.
Wow. So did they try to titrate to respiratory drive, or were they just trying for consciousness, or what was their approach when they were medicating you with the repeated doses?
To be honest, like I said, I don't know what dose they used. All I know is that I would go in and out. So I'm assuming that they would give me a little bit. I don't know if they were giving me zero point 0.4 at a time or just giving me the 1 or the 2 milligrams at a time. I'm not sure. But I do remember going in and out, in and out. And I kept asking what was going on. They kept saying that I was going out, that I kept going back out, and they had to keep redosing me.
So, after you've gone through recovery, do you have any specific concerns, or do people have generally concerns about, receiving pain medication? Let's say if you were to, have a skydiving accident and break your leg or something along those lines. Is there a concern with receiving pain management from either EMS or long-term, for the recovery from that injury?
There is a very big fear, and since you brought that up, that's exactly what happened to me last year. I had 14 months clean at the time. I broke my femur and dislocated my shoulder after a skydiving accident. And honestly, besides the pain, that's the first thing that popped in my head was I know that I'm about to get surgery, and I'm not sure if I'm going to be able to tolerate this without pain medicine. So they gave me fentanyl on scene. And of course, the first thing I thought about was, when I get it, am I going to miss this high? Is it going to be an immediate relapse or whatnot? But it wasn't like that at all. When you're in true pain, it takes care of your pain. It's not about the high. It's nothing like that. And I spent the next 12 days in the hospital and, obviously receiving opiate medication during that whole time. Then I got sent home with a prescription. But to answer your question, in my experience, this is person to person. It's different for everybody. Some people choose not to take opiates whatsoever. But for me, I'd never been in that situation, so it was just a learning curve for me that I had to experience to figure it out. I wasn't doing anything for my recovery at the time, so when I started getting those prescriptions and receiving those the opiates again, I'm a member of Alcoholics Anonymous. Like I go to meetings, I have a sponsor, stuff like that. But at the time, I wasn't doing anything like that, so I had nothing to fall back on. I had no, and I wasn't being honest about what was going on. I was just trying to tough it out, and I was trying to that addict mentality of the delusion that that we got this. Like I got all this under control when I didn't whatsoever. So to answer your question, it's not it wasn't the first shot of fentanyl what did me in. It was the continuous habit that got me back to the point where I was physically withdrawn from the medicine again.
So, being a paramedic, if you happen to have a patient who has some sort of injury and they happen to be someone who's in recovery, what would be your approach for the pain management?
So I had a lady the other day who she stuck her finger in some lawnmower blades, or in a lawnmower blade, and amputated a couple of her fingers. And before I asked her if she wanted pain medicine, and when I went to do the IV, I noticed a lot of scarring on her arm. And so I just asked her what it was from, and she told me that she used to be an IV drug addict, but she had 21 years of sobriety. And of course, I congratulated her on that. And I said, but this medication I'm giving you, fentanyl, is an opioid. Are you okay with that? And she was okay with that. And I don't press it on anybody. I don't try to talk anybody out of it. That's their choice. That's their sobriety. It's their life. They can do as they please. I know for me, from breaking my leg, when you have true pain, that you need that stuff. And a lot of people I've seen over the years, a lot of medics will withhold pain medicine for whatever reason. But again, it's a lot of people in healthcare carry around egos and that don't want to give pain medicine, that think that it's cool to withhold pain medicine for whatever reason. But she accepted the pain medicine, and even though opioids weren't her thing, it's she still had to be cognizant, that I was giving her narcotics, and even though she had 21 years of sobriety, it could that could go away very quickly. But yeah, she definitely warranted the fentanyl.
Would just out of curiosity, would a different approach, maybe like a ketamine, would that, since it works on different receptors, would that maybe have less less of a cross dependence for someone who's in recovery? I'm not entirely certain of the answer. I'm just wondering if you had any perspective.
Again, I think that's really patient dependent. We don't carry ketamine at the service that I currently work at. When I was flying, we carried ketamine. We would give it for pain medicine, but most often we would give it for sedation. I think that ketamine is a good, viable option as far as pain management. However, there's ketamine abuse too, abuse out there too. So, you have somebody that ketamine's very big on the rave scene, where you see a lot of your MDMA, your ecstasy, your all your hallucinogens, stuff like that. So, I mean, obviously any drug can be abused. But again, I don't think that's for us to judge or to make that choice. We leave it up to the patient. Hey, this is a narcotic. If you're in recovery, just know that you could feel a certain high from this, and I'm offering it to you if you want it. If not, then that's really your decision.
So let's talk a little bit about life after recovery. Once you manage to get clean and kick the habit, and you try to get back into a normal life, what obstacles did you face in terms of your recovery, both in terms of your employment, your professional life, how are you treated by your colleagues, what was recovery like, and what are some of the challenges you faced?
Yeah, so for me, I went to rehab. I went through the detox process, and I went to rehab, and then I actually entered into a sober living program, just for another staple in my sobriety. It's the first time I've ever done sober living. So I took a step back from EMS just because it was what was best for me at the time. Until until I could really take care of myself and take care of my everyday life, I wasn't about to put myself in a position where I could take care of other people. I take my job very seriously, and it's something I love doing. So I didn't work for about 4 months, and then I'm very open and honest about my recovery with anybody that wants to talk about it on social media, just so I can share my story to try to help other people. And actually, when I interviewed for the job that I work at now, I told them my situation, and if they needed to hold me accountable as far as random drug testing or whatever, that was completely fine with me. Just because but the fact that I am so open with it, I knew that it would come out and they would find out at some point, and I just wanted it to come from my mouth versus word of mouth or all the rumor mills and stuff like that that's associated in healthcare. So, but as far as my recovery, I've been clean now for a little over 6 months, and the response that I get, it's not what I thought that I would get years ago. I used to keep my addiction very quiet, secret, but because of the program that I'm in, and then I see how much talking about your story and helping other people helps people. That's why I share so openly. So even when I do share my story and people know that I am a paramedic and that I'm in recovery and that I'm a father and I have kids and I'm just an everyday person, a lot of people that I have no idea who they are, they reach out to me just saying, I do this for a living. I'm afraid to come out. What did you do? What helps you? Did you ever lose a job because of it? Does your job give you crap for it, or do you have support? And the answer is I do. And you'd be surprised how much respect people have for you just to admit that you have a problem. Because to be honest with you, like, you're usually the last person that finds out that you have a problem. People around you notice that there's something wrong before you do. And willing to admit that you have a problem is one of the hardest things that you'll ever have to do. And aside from actually asking for help. So yeah, my colleagues are very supportive. My friends and family, they're very supportive. Of course, you have those people in the background that are going to be judgmental, and that's fine with me. I know the stigma that comes with the addiction, but I also know like who I am, what kind of medical care provider I am, what kind of father I am. So that's why I'm completely fine with being open about my addiction. And if it just helps one person, then to me, that's all worth it.
Well, I certainly give you major props for being willing to talk about it and, help to share your story. I think that maybe if some paramedics, see through your perspective, maybe it'll change their individual perspective. Maybe people will stop looking upon, these nameless, faceless junkies that we treat as, some sort of, worthless person, and realize that it's our friends, it's our colleagues that tend to encounter this sometimes. And we are always prone to talking about, the brotherhood in fire or EMS. And one place where we could be failing our colleagues is by failing to, respect the disease process that could impact some of our colleagues like yourself.
Yeah, and I was, being honest, like I was one of those people before I was a drug addict. I was very judgmental. I used to give my patients hell all the time about, can't you just see what you're doing? Why don't you just stop? And I wish it was that easy, but it's not. And I had to become a drug addict and go through recovery to really appreciate like how difficult it is and how it truly can happen to anybody. Um, I know you're on a lot of EMS blogs, so am I. And all the time when the whole Narcan debate comes up, we see, just let nature take its course, just let the junkies die, let them get what they deserve. And of course, it pisses me off. And I used to go back and forth with people all the time about that. But it's just they're just naive. They don't know. But like we're here when we went to EMT in paramedic school or nursing school or whatever your profession is. Like there was no class on this is how you judge people. We set judgment aside. We have a job to do, and that's what we're there to do. And I would like to think the people saying just let them die don't actually let people die. I'm sure it's happened before, but I know even when I did pass judgment, I've never withheld any kind of treatment to anybody, whatever the judgment that I had may be. And the whole, like you said, people talk a big game as far as the brotherhood and the community of EMS. But I have seen people turn their backs on people when they have mental health issues or drug and alcohol issues. And I guarantee you there's somebody at your work, and this goes for everybody, that's struggling with either mental health issues or a drug and alcohol problem, and you just don't know it yet. And if you're involved in a conversation where you're bashing quote unquote junkies and drug addicts and alcoholics, they're going to be more likely not to ask for help because of that stigma. They're one conversation away from either asking for help or not asking for help, and that could be the decision between life or death for them. I know that there's a lot of people that commit suicide in this industry, or a lot of people that go without treatment for their drug and alcohol addiction, and it's because of the fear of judgment, because of the stigma behind it, because of the people's judgments every single day. And everybody goes through things. It's just that some people think that their problems are not as bad as other people's problems. Like we discussed yesterday, you got the 300-pound guy judging the drug addict, saying he's killing himself. Meanwhile, his cholesterol's in the 500s, and he's one cheeseburger away from having a heart attack. And that's
we all have our vices.
Yeah, we do, exactly, and that's my point. We all have our vices. We just choose to look at drugs and alcohol as the worst out there. People have gambling addictions, sex addictions, pornography addictions, eating addictions. I mean, addiction is in our everyday life. It's just, is it affecting your life, and how bad is it affecting your life? And drugs and alcohol just seem to be at the pinnacle of addiction. But as far as the stigma, I made a video a couple years back about this, and about just let the junkies die. If you looked at it as if that junkie were your mom or your son or your daughter or your dad, would you really have the same prejudice against them, or would you set judgment aside and say, hey, if I Narcan this patient, their life could turn around? I mean, somebody Narcan me and my life turned around, and now I'm paying it forward, and now through my program of the 12 steps, like I give back what was given to me. Like you never know what Narcan and somebody, or just treating somebody with human decency, can do for people.
Well, I think Narcan may not necessarily treat the overall disease process. It certainly gives people a chance to get into that recovery, because if you happen to die from your overdose, you're not going to have any success with a recovery program.
Right. And like I said, it's not your decision. Okay, if I give this Narcan to somebody, are they really going to turn their life around? That's like saying, if I give this fentanyl to somebody, is that going to cure their femur fracture? Is that going to cure their, whatever they got going on? That's, you're just treating a symptom, but at least you can give them another chance. And if they decide to get better, that's great. If they don't, that's just something that we have to experience. Everybody's rock bottom is different. Some people just have to go a little bit lower, or a lot lower actually, to want to get help. And until that person wants to get help, they're not going to get help. I mean, that's just the truth of the matter. And a lot of people die from this thing every single day. But I just know, for me, I wouldn't want to be a part of their death. Me not giving them Narcan, or giving them the treatment that they need when they possibly could turn their life around. I think if EMTs, paramedics, nurses, doctors, if they saw the big picture of this thing and how truly bad people wanted to get clean, then they'd probably change their mind. And like I said earlier, like, treatment is not easy to get into. It's almost like applying for a college. Just because you go to detox and say, "Hey, I need help," you're not always going to get in. That's when the whole insurance thing comes into play. Do you have enough money to actually get the help that you're asking for? I don't think people realize that it's not easy. Not only is it not easy asking for help, treatment is not easy to get into. There's a waiting list on a lot of these rehab facilities just to get into, and it's not that a lot of people don't want to get help. It's not everybody has the resources that I had, or that you may have if you ever have a problem. It's just, it's not that easy.
Well, I want to shift gears for just a moment. We're talking about reaching out and asking for help, but oftentimes people are well into the disease process before they realize and admit to themselves that they have a problem. Mm-hmm. What are some steps that agencies can take to detect people who have a problem and hook them up with the resources to help them through the problem early, before it becomes a serious issue and before you have paramedics stealing CS? What are your thoughts on things like random drug tests, and what's the best approach to treating a positive result?
Yeah, that's a good question. So the service that I work for, I didn't know this until the other day, but I actually got random drug screened. They do it quarterly, and I think it's a great idea. And I think a lot of feelings might get hurt from that. Like, they might feel like they're being singled out, or like, I don't do drugs and alcohol. Like, why would they even come to me? And again, that's the whole ego come into play. Like, it's not about you. I guarantee you, there's somebody at my job that's struggling with some type of problem. That's one form of accountability. That's a big part of accountability, to be honest with you. And it was a straight up random drug test. I actually just cleared the call, and as soon as I cleared the call, they put us out of service and sent us out for a supervisor detail. And I had no idea what was going on until I got to the hospital, and they drew blood, and I gave urine. So, also,
I always dread the you're going out of service to see the supervisor, so
I know.
It must have been stressful. What did I do?
Exactly. I started talking to my partner. I was like, "What do we do? Like, did you say something to that last patient to piss him off?" For sure, I had no idea. So it's kind of weird that when I found out I had to take a drug test, I was relieved that was what I had to do. Another big thing is the stigma with the mental health and EMS. We like to, especially as men, we like to beat our chest, and like nothing bothers us, when a lot of stuff bothers us. We just don't talk about it. I think there should be a lot of mental health support, maybe even like a peer group, or just more. I don't think CISD should be just for the bad calls. I think it should be offered at least monthly, to be honest with you. Like, hey, we're holding this group once a month, or hey, if you need help, they'll be 100% anonymous. Come talk to your supervisor, come talk to whoever they have set up.
Paramedics Anonymous.
Paramedics Anonymous, yeah, for sure. And I've actually tried to put something together like that. Not necessarily just for drug addicts and alcoholics, but for mental health disorders too. I mean, we run bad calls all the time. I mean, yeah, a lot of stuff we run is BS. But it only takes that one call to really affect people, and just to know that like that support is there, that we can actually talk to people and have zero judgment and not have a fear of being made fun of or whatever. Like it's not like we're human beings. Like we're gonna have feelings. It's not a bad thing to feel a certain way about a call or to let a call bother you, to cry over a call or whatever. Because for me, the only thing that I knew how to do was go home and use drugs over it. That was my only coping mechanism at the time because I just thought that that was the healthiest thing for me at the time. As crazy as that sounds, because I didn't want to tell anybody what I was going through. I didn't want to, like I'm an alpha male. I don't want to talk about my feelings. That's the mindset and the mentality that I had, and it wasn't until I started going to treatment and have years of therapy to realize like it's okay to be vulnerable.
So, what should an employer do with a positive drug test? My concern is that lots of employers or agencies will say, well, if you come to us first and tell us that you have a problem, then we'll forgive the positive drug test. But to me, that strikes me a lot like saying, well, call the fire department first and let us know that you're going to have a fire, and
Right.
then, we'll forgive that. I think that people will only be able to admit to their employer that they have a problem once they realize it and admit to themselves. And that's a fair ways into the disease process. What should be a good first step for employers to take, if they find someone with a positive test?
Um, so if somebody does pop hot on a drug screen, I definitely think the employer should offer help and leave it up to that person what they want to do. Because firing somebody sends one message. Number one, that you're not allowed to have a problem, and you're definitely not allowed to talk about it. Because what message does that send to the rest of the people in the community that is struggling? Like, oh, like I was gonna tell them that I had a problem, but now that I know that Dominic got fired for peeing hot, like there's no way in hell I'm gonna go ask for help now. So yeah, that's and I guarantee you that losing your job over your addiction, that's only going to make the problem worse. If jobs are really there to support their employees like they say that they are, like most credited services say they are, then they need to do what they say they're going to do, and stand behind what they say as far as helping their employees, and that's where the whole brotherhood thing comes into play. So you know I never peed hot or tested positive at a drug test, and I'm not saying I wasn't high at work ever. I never did. But I know people that have, and the company that I worked for a few years ago, they actually did offer the guy treatment, and he did seek treatment. And I think firing somebody for that it's disgusting, to be honest with you. That's like I said, it's like saying you're not allowed to have a problem. Now, if you get into vehicle contact and you're intoxicated, or you cause a patient harm, you know, then we're talking about two totally different things. But just, testing positive on a random drug screen, I definitely think that they should be offered help for sure.
I like the euphemism of vehicle contact.
Yeah.
So it looks like there's an overall spectrum. It can go from anywhere from something relatively minor, where you're only harming yourself and coming up positive on a urine screen or a blood screen, going up to a mid-level of theft of controlled substances from the agency, and to the ultimate extreme would be the surreptitious replacing of the controlled substances with water or saline, which not only harms you, is now also harming the people that we are entrusted to care for, the patients.
Yeah.
So where's the line of I don't even want to say what's acceptable, but where's the line of what can be tolerable and what should be absolutely out of the question for anything that can be tolerated?
I think where the fine line comes into play is when you start harming other people. You know, when I was shooting heroin, I'm hurting myself, and not saying that I couldn't have harmed anybody else. But when you start diverting drugs and replacing it with saline, then yeah, that you're not doing what you said you're doing. That's like typing a PCR and saying that I did a 12 lead, started an IV, and gave aspirin nitro when all you did was give somebody a ride to the hospital. You're falsifying info, especially not only is that wrong, it's morally wrong when you're telling somebody you're giving pain medicine. Like for me, for example, just going through it and having that femur fracture, if somebody would have given me saline, number one, I would have known if I was getting fake drugs, just because I know what that opioids feel like. But number two, it would have pissed me off. Even being a drug addict and being more understanding of addiction, um, there's things that are acceptable and there's things that aren't. People try to rationalize an irrational disease as far as like why do people do the things that we do in our addiction. And you're never going to rationalize it. But the thing is, like, we're not thinking clearly, and I'm not saying that stealing or getting high at work or drinking at work is acceptable by any means. But when you start diverting drugs, when you start stealing your patient's meds, when you start doing that kind of stuff, that's when not only is it morally wrong, that's when legality comes into play, and you're going to face some jail time. Clearly, you're going to lose your job. Um, However, with all that being said, at the end of the day, these people still need help. They still have a drug and alcohol problem, and throwing them in jail or firing them, just doing that, it's not going to fix the problem. So if you really want to help somebody, along with jail sentences or firing them or whatever, you at least need to give them the resources to get the help that they need.
So besides obviously, positive urine tests, what are some of the signs or symptoms that colleagues and employers can pick up on that might indicate that someone may have some sort of thing that they're struggling through, whether it's alcohol or whether it's opioids or some other addiction that they're struggling with? Would it be something like absenteeism? What signs can people be on the lookout for in their colleagues?
I'll just tell you my dead giveaways. My dead giveaways is isolation. Like I'm a pretty active person, like being social, especially on social media. I talk to a lot of my friends, and when I go missing, that's my dead giveaway when I've relapsed. Um, and work. So I would start calling in. I was not punctual at all when I was at work. Um, I would I wouldn't be like I have a very good bedside manner, and I wouldn't be as active with my patients. And your partners become your really good friends, and they started noticing, like, what's going on with you. And I would just use the excuse of, I'm just going through some relationship issues, or this past time when I came back from my injury, I was like, oh, like I'm just down and out from that. I'm still not over that whole experience. Um, but those are the dead giveaways as far as just people acting different. If you're close with your partner or your colleagues, like, you're going to notice a difference. I'm not talking about somebody just having one bad day. It's going to be that continual, like, Dominic's not he hasn't been acting right for the past month. Like, something's going on. And then people say, like, well, it's not my business. I shouldn't pull it out of him, or I shouldn't talk to him about it. Like, you absolutely should. If you truly care about that person and their well-being and the well-being of others, you're going to pull that person aside and be like, look, I've noticed something's going on. Like, normally you come in 30 minutes early. Now you're coming in 30 minutes late. People are starting to talk. Like, when those things are apparent, then there's obviously something going on. And it might not be drugs or alcohol. It may be relationship issues or issues with anything, but something needs to be done regardless if it's drugs or alcohol. Just noticing the everyday behaviors of people. I know for me, I had lost a bunch of weight, so people commented on that, and of course I palmed it off on, well, I broke my leg and I just haven't been in the gym and my appetite's been crappy and all that. And then I was incredibly depressed. I'd keep my head down. I wouldn't talk to anybody. Um, I just was I turned into a hermit. I wasn't doing anything, and I didn't care about being there, and it clearly showed.
I think that if people notice that I started to act right as opposed to my normal not acting right, people might notice that.
Yeah, yeah. I mean, people know me. I mean, I have a very dark, crazy sense of humor. So when I'm not cracking jokes and making inappropriate jokes and stuff like that, like, something's usually going on with me. Either I'm having a bad day, or if it continues, like I was talking about when I did relapse last year, that something's definitely going on with me.
So do you think you're going to make a return to skydiving?
Oh, I already have.
You already
Yeah.
have?
So I got hurt in January of last year, January 15th, and I started jumping again in October. Obviously, that's between all my relapses and my going to rehab and stuff like that. Yeah, I started jumping in October again, and I still go just about every week, if not every other week, just depending on the weather.
Well, I think skydiving is still safer than having a heroin addiction. So that's
Yeah,
probably the best option.
yeah, for sure. And people think that I've replaced heroin with skydiving. It's not the case. It's become one of my passions, my biggest hobbies, and I just love doing it.
Were you one of those guys who would jump out of the airplane with his legs still in a cast?
You know what? There are guys that I jump with that do that. I didn't have a cast. I got a titanium rod put in me. I mean, I was pretty scared to do my first jump. I don't know if I would have jumped if I did have a cast on, but especially on my leg. Maybe if I had my arm broke, I would.
Well, it's all about that landing. As long as you've got two legs that you
Yeah,
can land on.
yeah, I know all about that hard landing for sure.
Well, Brad, thank you so much for joining us and talking to us about your perspective. Hopefully, this lets paramedics see through the eyes of one of our colleagues and not just some random nameless, faceless junkie on the street. This is a problem that's nationwide, has no job, specifications, no class specifications, no demographics that it specifically affects. This is universal across the nation.
Yeah,
So,
it's only getting worse. Especially since the carafentanil, the fentanyls came into the mix. The heroin is not getting any weaker. It's only getting worse, and we really do need to crush that stigma. And like I said, I'm not. I have no shame in my past. I share my story openly, so hopefully that I can help others and encourage others that are struggling, that think that they can't ask for help. Can reach out and ask somebody like me for help. So anybody watching this, you can find me on Facebook. You can message me, and I'll do what I can to help.
outstanding. Well, until next time, everybody, we'll return with our normal cardiac series. Take care and keep thinking differently.